we were traveling in Aravali on Saturday, that's wild, and then we were accosted by a person who was probably asking for help, and he told me that there's a medical emergency up there, and since I frequently travel with my friend and we usually carry some medical supply, so we decided to have a look. So we started following that person, and it is quite sandy, like it is like almost a desert, and even climbing going there was difficult, and it has all kind of stuff. It is rocky, it is dusty, but at the outset you should be aware of a wild animal, but here only dogs were there, so we could climb safely. You should be aware of wild animal, they can attack you, and it is midnight. Okay, so we were following that person, and you can see all kind of vegetation, thorny, and the dusty area, and the sometime you get a rocky area, and we were climbing in the hope, and I was anticipating what could be the problem, but my concern was airway or the breathing. Okay, so or the circulation. Okay, I was thinking in terms of ABC. So slowly we approached that person, and what we found there was a person lying, and his whole face was covered with dust. Probably he was chased by wild dog and fell down, and he was still gasping. So my immediately thought was to do a cry, but now how to do this? Because in emergency, in medical setting, in hospital setting, we have all the supply, but here I could have only my Swiss knife, which I usually carry, and this is what we are going to show you in this simulation on worm mannequin. Now, worm mannequins, we have different kinds of mannequin, and this was one long-lasting dream that we want to do a wilderness simulation. Okay, so we will just show you for the sake of demonstration the supplies we will be using. So, and how we improvise a 2 cc syringe in a TT tube, tracheostomy tube, and then we could attach that plunger, the plunger with the BVM. So, yes, my friend, he is cutting. So, first you have to take a 2 ml syringe, you cut it at an angle so that sufficient length can go inside. So that's one thing, and be careful, you should not cut your finger, doesn't get any gas. So we are cutting it here, and we know that even if we have oxygen, it's not going to work because his mouth is full of dust, and we need to do a surgical crike or the open surgical airway or ephona. So we have taken that, we have cut it. Now what is next? What we need, of course, we need to wear gloves, and in impulsion sometime we forget, we try to save life. That's our system one thinking. So he's cleaning, that's what we have, only gloves, loose gloves, and he's cleaning the dust of the neck. And what I'm looking is basically all the supply, whatever can help us to do this procedure in the wild. So getting ready to take the cut, but before that we will show you what else we have in our bag. It's not a full bag of medical supply or a taco bag. So there's a ammo bag there, and now this is the syringe we have cut, and the next point is going to be that we are going to have a water bottle cap, because that cap, from the inner side of that cap, yes, that's the water bottle we were carrying. So these are the routine stuff we carry usually with us. And now what I am going to do is to cut a hole in the cap from the inner side, okay, so that the tube, you guessed it right, so that the tube can get inside and inside the neck. So you do this, like you make a hole, not a perfect hole, but in emergency, in life-saving scenario, we don't have to be perfect, only suboptimal your arrangement or your skill or your precision can work. So you insert this syringe, the cut syringe, with like this. There are flanges which will rest on the inner side of the cap, and I usually carry dental floss. So we use this thread to tie the improvised tracheostomy tube. So these things happening, and this is the arousal area. So here I am going to take the cut. I have already done the handshake. And now here I would like that if you are unsure, then put your pinky in the sternal notch, and the index finger will be over the cricothyroid membrane. That's what I have shown. So I put the index finger, and there it was, the cricothyroid membrane in emergency or in obese patient. So after the cut, rotating the knife, and then I am putting my pinky to dilate the hole. So this skin is almost human, like a human being. So it tends to close. So you need to keep it open, sometime manually. So we have inserted our improvised tracheostomy tube. But the problem is that the BVM, the mouth, the portion which goes towards the mouth, to the tube, is not attaching snugly. So what we are improvising. We are putting the IV tape around that tubing, so that it fits inside of the water cap. So let's try that. So whatever we have, we are trying to improvise, and let me see if it works. So now Tarun is trying that, and you have to hold the tube manually till the time you tie it. So yes, there is a chest tie. You can see flies also, ants also. This is a classical, the typical wild area, the ants are over the patient's body. Okay, they rise, but it's a mild rise. So I think we need to apply more IV tape over that stump. Yes, and now we have done that, and now he is bagging, and now you see there is a clear chest tie. You please concentrate on the lateral side of the chest, and you will observe the chest rise. So we have tied the improvised TT2 with the dental floss, and one more time. Now it is more stable. So just look at the lateral side of the chest. It's rising around the nipple. So that's we want wanting. Oxygenation and ventilation, both things are happening, and I'm sure that this man will be saved. So these are the things. The problem was that somebody could put the barrel, but either you can give mouth to mouth, or you need to attach the BVM. So my improvisation here is that I could attach the BVM with that with the syringe. You can see this is wild, total dark, pitch dark, nothing available, no help can arrive in time. So my point is that in India we keep in having this kind of disaster, and if we can improvise upon whatever we have, like what we did for this patient, I think we will be saving many more lives. And I would urge my fellow being to have that kind of mindset. The area here is to take the decision and the mindset that you should think how differently we can do these kind of stuff which are life saving. And with worm mannequin we can have all kind of scenario, everything. So again, coming back to our equipments, this is the Swiss knife. Every physician should carry that with him, and this is the water bottle, this is the IV tape, and the ambu bag, and it will definitely, as far as Airway is concerned, will help us in saving life. And again, requesting you to have that kind of mindset. Just think how differently you can do these kind of stuff which being done in the West. And that's what I thought, and thought, like, let's give it a try if we can succeed. And definitely we have done that, and patient is now being oxygenated, and